Breaking: a new Ebola outbreak is now raising fear across parts of Africa, and health officials are warning that the virus may already be crossing borders. At least 65 deaths and hundreds of suspected infections have already been recorded in Congo, while Uganda has confirmed an imported Ebola case linked to the outbreak. Now, what is making experts even more concerned is that this may involve a rare Ebola strain, one that current vaccines may not fully cover. And now, governments and health officials are racing against time to stop another major health emergency before it spreads further. Don't go anywhere. I'm Pigs, and you're welcome back to my channel, Pigs Normal News.
Ebola? We're doing Ebola again? Yep, we're doing this again. Move over hantavirus, because a new Ebola outbreak has been confirmed in a remote area of the Congo, Democratic Republic of Congo, with 65 fatalities so far recorded and over 200 cases confirmed. Before I move on, I want to make sure you understand Ebola is not airborne. It's not like hantavirus. It's not like COVID. This is not likely to become a global pandemic, but we still need to pay attention to this. And it's a strain we don't have an Ebola vaccine for. And if you're already going to go in my comments going, I will not comply, I'm not going to get the vaccine, you won't need to. It's okay. You need to come in direct contact with infected bodily fluids. That being said, it can spread very quickly, especially in areas where there is lack of medical facilities and poor sanitation. Neighboring countries are on alert, particularly South Sudan and Uganda. Uganda has already confirmed one case and fatality, but the individual who lost their lives was from Congo. What is the U.S. going to do? Well, acting head of the CDC, Jay Bhattacharya, said that U.S. health officials are in contact with officials in Congo and Uganda and, quote, going to provide whatever they need that we are capable of providing them. Which probably isn't much, since the Trump administration has absolutely gutted the CDC, cut funding to the World Health Organization, and specifically cut funding for research directly tied to Ebola. Ebola is not airborne, so this is unlikely to become a global pandemic, but this is something we need to keep an eye on.
We have serious news this morning. A new Ebola outbreak has been confirmed by Africa's CDC in the Congo, with 246 suspected cases and 65 deaths so far. A lot of you have reached out overnight. There's no threat to the general public here in the United States of America, but it is a very serious outbreak nonetheless. Over 200 people have contracted the deadly virus, and based on preliminary reports, 65 have been killed. This new outbreak comes about 5 months after the last outbreak in the Congo, with about 43 people dying from that Ebola outbreak. This new outbreak, according to the Africa CDC, is located in the Ituri province, which is a remote province in the eastern part of Congo. There is some concern of spread to neighboring countries like South Sudan and Uganda, according to the Associated Press, just merely given the proximity of where this outbreak is occurring. Once again, there's no threat to the American public at all right now, but a lot of you have reached out, so I wanted to tell you what was happening. Spread the word, follow.
The Ebola virus is now officially considered out of control in West Africa. So much so, the U.S. Peace Corps is pulling its volunteers from the region.
To the deadly Ebola outbreak, and a new warning tonight from one of the nation's top doctors, the head of the CDC, warning that the outbreak in Africa is even worse than we feared.
Now, I don't know if we can still remember the trauma of past Ebola outbreaks. The fear is not just the deaths, but how quickly outbreaks can grow if delayed. Now, experts are monitoring the situation so closely. Containment efforts are already underway. There is no reason to panic. Let's not panic, because authorities are taking this seriously. Now, let's stay safe and be prayerful.
In Congo's Ituri province, health officials are battling a new Ebola outbreak. The Africa CDC says there are 246 suspected cases and at least 65 people dead, the highest death toll from the disease in years. The World Health Organization is concerned.
Well, we know very well that the country has experience, but the region where it is happening is highly volatile, with the humanitarian situation going on and the population moving around from South Sudan to Uganda and other parts.
Government officials confirmed the outbreak has now spread to Uganda.
Medical professionals seem very concerned about the possibility or the ability to contain this. Why is that compared to other times?
It's already a big outbreak at the point that we're hearing about it. There have already been a number of deaths, and this is a strain of Ebola for which we have no treatment, no vaccines.
The virus spreads through direct contact with blood and other bodily fluids. Dr. Craig Spencer contracted Ebola while working in Guinea in 2014.
Healthcare workers are the group that I'm really concerned about because they have very close contact with people when they're most contagious, particularly around the time of folks' death.
And the U.S. has been the single largest external player in Ebola response in the past. Now experts are worried that the dismantling of USAID and the U.S. withdrawing from the World Health Organization could have an impact in the global efforts to contain the virus.
For now, health officials say surveillance and emergency response teams are already working to contain the outbreak. But with fears of cross-border transmission growing, many people are now watching closely to see whether the situation can be controlled early or whether it could become something much bigger. What do you think about this latest outbreak? What do you think? Let me see your thoughts in the comment section.